Okay, well, thank you for joining us for another of our Ask the Expert sessions. Today we're focusing on managing cancer-related fatigue, and we have Leslie Pickering with us to speak on this topic today. I wonder, Leslie, if you could just introduce yourself to everybody today. Thank you.
Yeah. First of all, thanks for inviting me to come and speak today. My name is Leslie Pickering. I'm a specialist occupational therapist. I work currently both privately for Northwest Fatigue Clinic, which is a private clinic treating people with fatigue for many different reasons, one of those being cancer-related fatigue and also ME/CFS. And I also work with Yorkshire Fatigue ME/CFS Service, and that's an NHS post that I've recently taken. But initially, I started my career working at Pendleside Hospice in the day therapy unit there. So met a lot of people that were struggling at that time with cancer-related fatigue. And that was really, I suppose, where I started to help those that have a diagnosis of cancer and a symptom of fatigue with that.
Okay, that's great. Thanks very much for doing that. We'll just crack on and start with our questions now, if you don't mind. The first question we have is, fatigue is something that affects many of our mums to varying degrees and at different times from their diagnosis of cancer in and around pregnancy to beyond the end of their treatment. Could you talk to us about the varying factors that may be contributing to this limiting symptom?
Yes, and there are a lot of factors, that could be going on for different severities for different people. And I think it does start, as you said, Fiona, right from that diagnosis. If you think about the time when you gained your diagnosis and the stress and the anxiety, the uncertainties around that, that's something that will immediately bring on the stress response within your bodies. And that in itself is something that brings fatigue with it. If you think of any time during your life where you've been anxious, sitting an exam, driving test, any of those things, there's going to be that element of emotional stress, and that is going to bring fatigue with it. So that's just one of the reasons. We then start to look at the treatments that maybe you've been experiencing, that you are experiencing at the moment, and looking at those different treatments there, looking at chemotherapy, what's going into your body, the fact that treatments can be quite aggressive, they can be quite invasive, and the treatments themselves can actually have those side effects of fatigue. So again, that's another reason that the fatigue could be manifesting for you. Also looking at comorbidities. So it may be that you've had other illnesses running alongside of the cancer that may again have an element of fatigue with them. Thinking again, with pregnancy for people, anemia is a common one. That's something that has that element of fatigue with it. And also other, hypothyroidism. There could be lots of different things that are going on alongside of the cancer. And I think it's really important there to be looking at the bigger picture, to be looking holistically at what you've got going on for yourselves at the moment, just to check in that there are, knowing that there are different reasons for the fatigue means that you've got to be assessing all of those different reasons. Another one may be pain. Pain, again, may be caused by a comorbidity, another illness that you've got going on. It could be a historic pain that you've got, but that will be contributing at the moment to the cancer-related fatigue. With pain, obviously, we know that that's a big demand on somebody's body, and we know that it can be quite relentless as well. It's something that's there a lot of the time to different severities, and it's not always treatable. Obviously, there are analgesics, there's those painkillers there, but it may be that there's always a level of pain that's going on. And when we're looking at fatigue, we're looking at any demands on the body. So pain can be a big one that may need to be relieved in different ways, but I think just having that understanding of the level of pain and the level of fatigue that might be causing. Also looking at the tumour itself, looking at the tumour site, where that is, whether that in itself is something that is obstructive, whether it's something that's, there's been surgery for that to have partial removal or all of that removed, that again, that demand on the body of going through the surgery or even having the tumour, you know, wherever that may be, whether it's something that's causing other symptoms, you know, looking at symptoms of maybe nausea that might be causing, if you're unable to eat as much as you were before, if there's bloating from sort of ascites, then that might be affecting your ability to eat. It may be affecting your appetite. Obviously, when we're looking at fatigue, we've got to look at energy. So we've got to look at where that energy is coming from. And food is, again, you know, one of the most important things. So looking at how the tumour itself is actually affecting the body, again, that might be something to consider. Is there an element of fatigue that's being brought on by that? Also looking at medication. Medication can give side effects of fatigue, lots of different medications, not just medications for cancer, but it may be worth just exploring that with your clinical nurse specialist, with your doctors. Are the medications that you're taking, are they actually contributing? They probably won't be the whole, you know, factor, but they may be contributing to the level of fatigue that you've got at the moment. And if that's something that can be addressed and those could possibly be changed so to something with less side effects, then again, that's something worth looking at. When we're looking at fatigue, we've got to look at, when we're treating it, combating every possible area that's causing the fatigue. So that's why it's really important to know what may be causing it in the first place and looking at all those different aspects. With the medication as well, it's probably worth looking at, are there not just side effects of fatigue, but are there side effects of nausea? Are there side effects of vomiting? Does it give headaches? Is it going to be giving some of the other things that I've already spoken about? So is it worth looking at from that point of view? Again, are there changes there that could be made just to try to minimise the side effects that you're getting from the medications? Also looking at sleep and sleep dysfunction. Being, you know, sleeping too much and not sleeping enough can both contribute to fatigue. When we're looking at fatigue, we've got to look at the circadian rhythm, that natural body clock, and that can be upset with the treatments that you have in. It can be upset by, obviously, you know, if babies already come along with young children, that sleep deprivation again is something that can be contributing to the level of fatigue that you're having at the moment. None of these things are easy just to tackle. As you'll go through, as we go through a few more questions, you will hear how we can start to target them. But I think recognizing from a sleep point of view, knowing what to do with sleep, how to maybe start to regulate that is really helpful. And that's something that hopefully we'll go on to talk a little bit more about today. Also looking at mood and looking at low mood. The diagnosis itself is obviously going to bring anxiety. It's going to bring stress with it. It's going to bring, you know, a possibility of depression, a level of anxiety around what's happening, what's going to happen. You know, is the future going to be different? There's lots of reasons for somebody being in low mood. And we do know that with low mood, that again brings that level of fatigue with it. So again, that's something that's worth looking at in terms of whether there is any medication that's necessary for that, depending how severe that low mood is, whether it is manifesting as full-blown depression or whether it's just low mood, because obviously those two things are slightly different. It's also worth noting that with fatigue itself, low mood can be a symptom of the fatigue. And again, we'll talk a little bit more as we go through the session about how negative cycles can start. And that can be one of those, that fatigue can cause low mood, but also low mood can cause fatigue. So it's looking at trying to break those cycles that might have already started. Also looking at loss and grief. Anybody that, you know, has grieved for anything during their life will maybe have that knowledge that a level of fatigue comes with that. And if we're thinking about a diagnosis of cancer, you know, the future probably is different to how you may have anticipated it might be. So there may be that level of loss there, and that grieving for maybe a part of your body, or maybe for grieving for life as you thought it would be. So again, that can bring a level of fatigue with that as you come to terms with being able to deal with the losses that might be occurring at this time. So that again is something to bear in mind. That's a normal response, being grieving, having those losses, and having that level of low mood and that level of fatigue around that is absolutely normal. So again, it's recognizing that a level of fatigue for lots of different reasons is normal. So trying to fight against that fatigue can often cause fatigue itself. That can cause a negative cycle there. It is almost to have a level of acceptance that the fatigue is part of what you're going through at the moment. And that doesn't mean to say that it's got to be accepted that it's a permanent feature in your lives, but that it's something that's there at the moment. And it can be beneficial. It can be there to help to restore, to help you to recuperate. The body puts itself almost into that sickness response so that your body will fatigue, it will be fatigued, it will stop, you will rest, and that can be something that is needed. So fatigue isn't always seen as a negative. It can be seen as a bit of an alarm bell, a bit of a sign to say you need to slow down, you need to stop, to give the body time to enable to recover from what it's going through. Also looking at diets, looking at maybe what types of foods you feel you're able to eat at the moment. With pregnancy, there's certain foods that people don't feel they're able to eat. Are they foods that are very high in nutrients? With the treatments that you're having, are those nutrients that are in food not able to be absorbed? So again, even though you might have a good appetite in eating lots, if the nutrients aren't being absorbed, then the energy itself isn't coming from those. So that can be another factor. People often with treatment for cancer don't have a particularly good appetite, and we'll look at some different strategies around that to be able to try to combat that so that you're still having that energy put in. Because with fatigue, as well as looking at the demands on the body and where the energy is being taken from us, we've also got to look at where that energy is coming from initially, how we're putting that energy into our bodies so that we're trying to produce as much energy as possible. And obviously then the more energy we've got, then the less fatigue we should have. Also, you've got to think about, for those ladies that are pregnant, looking at the pregnancy itself. Any lady that's been pregnant will tell you it's tiring, it's exhausting. If you think about, what's going on in your body, producing that child, producing that baby, it takes a lot of energy. So again, normalizing it, it's normal to have a level of fatigue during pregnancy. And obviously for those that have become mums, that have got babies, that have got young children, again, that is a big demand. It's a big demand on the body. I'm sure that, for a lot of you, you've had other people saying, well, when I had my baby, I was fatigued, I was tired, all of those things. And I think we've got to really acknowledge that cancer-related fatigue is another level of fatigue added on to the fatigue that you may already be experiencing as a pregnant lady, as a new mum. So I think as we go through these questions, that might be something that you can pick up on, and also that you can maybe pass on to people that are, that are coming at you with that. Oh, well, I was tired. I think if you start to gain some understanding of what cancer-related fatigue is, what's causing it, then you can educate others in that, which takes away some of those frustrations that you might be feeling at the moment, because emotions, frustration, anger, all of those things again take energy from us. So that's another reason why you might be feeling fatigued at the moment. Okay.
Thanks, Leslie. That's great. I'll move on to question 2 now. So fatigue is not directly visible to those surrounding our mums, including family, friends, and healthcare professionals. However, the effects of fatigue on the individual, including physical, mental, and emotional, can be great and can subsequently affect many areas of their lives, including their close relationships, family life, and in some cases, returning to work. Could you talk a bit about the effects fatigue may have on mums themselves and those they interact with?
Yeah, I think that's a really good question, because I think, you know, fatigue itself is misunderstood, and fatigue is often seen as tiredness. Everybody has been tired at some time in their life, but not everybody has been fatigued, and it is very different. And I think the first thing to say about fatigue is that it is usually disproportionate to the amount of activity that that person has done. So normally a person would do something, have a level of tiredness, or just be able to carry on and do the next activity. With fatigue, people often describe it as they hit a brick wall. They've done a certain amount that day and they cannot do any more. Like the batteries become flat. They can't recharge it. And that no amount of resting or sleeping is able to recharge that battery. And again, that's something that's very different from tiredness, because normally with tiredness, we get an early night, we get a good night's sleep, we start to feel better the day after. And that's something that's very, very different with fatigue. It is quite relentless that day after day, that same level of fatigue can be there. People quite often say, you know, they feel like a plug's been pulled on them, everything's drained out, and they can feel that first thing in the morning when they wake up. They can feel it as something that's coming on through the day, that suddenly they get to a point in the day where they haven't got any energy left. So I think we've got to start to look at the symptoms, how it's going to affect people, what they should be expecting from fatigue. Now, obviously, before I start to go through the symptoms, we've got to acknowledge that these symptoms are not just symptoms caused by fatigue per se. So these symptoms could be for other reasons. And that's why obviously you've got your health professionals, the medical people there that are keeping an eye on you all the time and checking these symptoms. But I think it's worth knowing the symptoms that can come from fatigue, because it may be that you're having symptoms at the moment that you're not recognising as fatigue symptoms, and there may be that extra worry and concern there about them. So if we look first of all at physical symptoms that people might be experiencing, so, you know, a level of tiredness itself, looking at headaches. These might be new headaches, different types of headaches than you've had before. There may be headaches that come on after you've done a certain level of activity, particularly cognitive activities, anything that uses the brain, even to the point of watching TV, reading a book, looking through a magazine, having a conversation with somebody. All of those things are included as energy zapping activities that could cause headaches. Looking at joint pain and muscle aches, that general sort of feeling of not being well. Sometimes people get kind of flu-like symptoms, or feel that they're going to get flu, but then nothing actually manifests. Sore throats, anything that's affected really by the immune system. Low immunity itself, people quite often say, you know, catching one cold after another. And I understand that obviously some of the cancer treatments can have that effect on the immune system, but also fatigue itself can. You know, feeling that I'm going to get a sore throat, and then by the afternoon that's actually gone. That can come about with fatigue itself. Feeling breathless just maybe after a short task, you know, just going up half a flight of stairs and just feeling that you need to stop to catch your breath. Again, could be from part of the cancer itself, you know, particularly depending where that tumour is. But again, it can be a level of fatigue there that it's getting the body to slow down, to stop, to stand and rest for a while before you carry on with that activity. A level of dizziness, particularly when standing from sitting, that bit of a woozy feeling, that's again can be connected with fatigue. Your body and your limbs feeling heavy, people often describe it as just, you know, feeling like they've got lead in their limbs. They just real difficulty lifting up their arms, particularly when the body's going against gravity. So standing up in itself can be difficult for people. Usually, you know, having a shower, lifting your arms above your head to wash your hair, drying your hair, holding the hairdryer, those sorts of things can be really difficult for people. And also the sleep disturbances that we mentioned briefly before, either, you know, hypersomnia, lots and lots of sleep or hyposomnia. People are unable to sleep, which seems quite strange when people feel so tired. But it can be that people almost become tired but wired as well. There's a level of adrenaline in the system, particularly when people push through and try to push through that level of fatigue. Then the adrenaline can come in and help out, and then people then find difficulty sleeping. Also sleep disturbance in terms of getting to sleep quickly maybe, but waking early hours of the morning, not being able to return to sleep. So any sleep disturbance is going to contribute to the fatigue. And looking at cognitive elements of fatigue. So anything that you're using your brain for is a cognitive activity. Concentration span. People may find that they're just having difficulty even just holding a normal conversation. Meeting somebody that they've not seen in a while, can't remember their name. Trying to remember something that a loved one said to them 10 minutes ago and they can't remember it. Putting things in places, teapots in the fridge, those sorts of things. People often describe to me they feel like they're starting with dementia because they're just not remembering things. They're doing things that they seem quite odd to them. And again, that can be a part of fatigue. A feeling of brain fog. Feeling like they're trying to think, that brain fog, cotton wool in the mind, that's something, and in the brain that people describe to me, not being able to just pull things to mind, even though they know an answer to a question, but they just can't bring it to mind. Again, that's something that's really, really common. Speaking and finding that halfway through a sentence, they can't find the right words to say. That word finding difficulty. They know the word, a simple word, but it just won't come to them. Difficulty making decisions. It could be a very easy decision. Somebody gives you a choice of a couple of things, what you want to eat for your lunch. Can't make a decision between the two of them. Again, a really common one for people that can be quite worrying. And I think a lot of the cognitive symptoms can be worrying for people because quite often we relate to fatigue and tiredness and energy as a physical thing. Oh, I'm tired because I've been on my feet all day, or I've been busy with the kids all day on my feet. I feel tired now. But we don't tend to relate that as much to, oh, I've been studying all day and now I'm exhausted. So anything that uses the brain is using energy, and it's going to have that level of fatigue there with it. Even just having a simple conversation with people that you know very well, with your spouse, with your children, with with your parents, with friends, family members, just that simple conversation actually can be very draining. Just listening to me now is probably for a lot of you difficult to remember the information, to take that information in, and it's tiring. Watching TV, I think, with TV, we often think of that as a relaxing activity. We think of it as something that's a bit of downtime, particularly when we're working. It's something that we do at the end of the day. We've had our evening meal, we sit down, we relax, we watch TV. When we've got lots of energy, absolutely fine. It usually is an activity that takes less energy than what we've been doing through the day. But when we're fatigued, actually, there's a lot of different processes that go on to watching TV. You're remembering characters, you're following a story. Visually, there's a lot going on. Auditory, you're listening to things, you're piecing things together. You might have other things going on in the house at the same time. The phone's ringing, the dog's barking. So something like that becomes a big activity. So it may be that normally activities that you found easy, sitting reading a novel, reading a book, flicking through a magazine, actually could now be quite difficult in terms of being able to focus on them. If we look to emotional fatigue, anything that we feel is going to bring an element of fatigue with it. And that isn't necessarily negative feelings, even, feelings of being really happy about something, laughing a lot, getting into that hysterical laughter can be tiring. It can be quite exhausting. But obviously being tearful, being frustrated with the situation that you're in, having lower mood, feeling irritable. We all feel irritable when we're tired. So when we're fatigued, that again is emphasized even more. It's exaggerated. People feel anxious about the symptoms that they're having, let alone about the diagnosis that they've got and the treatment that got and how they're going to manage things in the future in all different aspects of their life. That feeling sometimes that they're not coping, you know, that they should be coping, feelings of guilt, feelings of, you know, am I good enough? Feeling overwhelmed by the situation and by the amount of things that people have to get done. You know, we quite often have a list at the beginning of the day. We've got in our heads all the things that need to be done that day. And when people are fatigued, it can be a visual cue that actually I've not done very much today. You know, I had 10 things on my list. I've only ticked 3 off and I've still got all of this to do. And these are things that still need to be done. So that feeling of overwhelm in itself can bring about more fatigue. Feeling angry, you know, why me? Why is this happening to me? This is something I was looking forward to. You know, why am I going through with this? All of that anger that may be inside. Sometimes with people, that lack of acceptance of where they're at in their cancer journey and what's going on, that can be building that stress inside the body. And that again can be affecting the fatigue. Feeling, you know, on edge all the time, feeling that they're in that stress response. If you think about when you get a cancer diagnosis, obviously there's lots of thoughts going on at that time. There's lots of uncertainties. And what our body and our mind does, it wants to protect us at that time. So quite often it will go into that stress response. It will go into that fight or flight. It doesn't know what's going on. So let's get the emergency response going. And with that comes a level of adrenaline in the system because it's needed. It's needed for fight or flight. You know, we need to get oxygen to the muscles quickly. Our heart needs to beat quicker to do that. But quite often with fatigue, with cancer-related fatigue, the body's gone into that stress response. It's gone into that fight or flight at the beginning. But actually, as you've gone through the treatment, as things are calming down, the body is still on that high alert and can be on high alert for longer than it needs to be. And being on high alert and in that stress response is something that can bring a lot of fatigue with it. Being in the stress response also brings about quite a few of the symptoms that I've spoken about. So, you know, if you're in the stress response and you're ready for fight or flight, you're not remembering what you need to pick up from the shops later on. You're not, you know, your body physiologically isn't set up for concentrating on something that you're watching on television. It's set up for, am I going to run away or am I going to stay and fight? So you'll see as we go through some of the negative cycles that stress response, that contributes a lot to the level of fatigue that people are feeling. So when we look at the negative cycles, one that is really important to talk about is the boom bust cycle. A lot of you may recognize that on some days you feel slightly better. Fatigue's still there, but you feel like you've got a little bit more energy. That to-do list is still there, so you want to get lots of things done and you push through and you keep going. And you get to a point where you're starting to feel fatigued, but you're still not quite finished everything on the list, so you keep going again. And that level of adrenaline will then come in and help out. It'll keep you going and you can carry on doing things. But there will be that payback for it. It may be that you have that day where you do more, but then you may get a couple of days following that where you crash, you hit that brick wall again, you can't do very much, and then that cycle starts again. So that's one of the negative cycles that will keep the fatigue going. So we will look at trying to break that cycle. I've already spoken a little bit about denial, about resisting changes maybe that need to be made, just trying to push through and battle through as you've always have done in the past because it's worked in the past, but it might not be working for you right now. Looking at different strategies maybe, you know, they could be scary in themselves and people, you know, change is difficult and you're already going through a lot of changes. Sleep disturbance, we've already spoken about. That can create a negative cycle because quite often if people don't get a good night's sleep, they will sleep in the following morning if possible. They will then get up later in the day. That will throw out the circadian rhythm. So we could get to the point even where people are awake all the way through the night and sleeping all the way through the day. And we know that that isn't helpful for fatigue. So that's again something that will keep the fatigue going. And we also know that anyone with low mood is naturally going to have less energy. So again, combating those things is going to help with that increase in energy. And we also know with fatigue, it's difficult to maintain activities, difficult to maintain social activities that maybe we were doing before, keeping those social connections. And again, if we feel quite isolated, as quite often people do that are fatigued because they're not able to leave the house and do those social activities, that can feed into the low mood, that can feed into more fatigue. Employment is something that can be extremely difficult for people, because you'll come to hear when we're managing fatigue that pacing is really important. And in the workplace, being able to pace your activities isn't easy, it isn't acknowledged. The fatigue itself isn't acknowledged. It's just, oh, well, you're a bit tired today, have a good night's sleep tonight, get on with it. So there's lots of things that can be done within the workplace to make things easier. Quite often people aren't able to keep up with their personal activities of daily living. You know, particularly if you've already had your baby, you've got young children, their needs are going to come first. So your own needs often are put on the back burner, and that means that even showering, washing hair, getting dressed each day, those things can be extremely difficult. And again, that doesn't make us feel good. You know, we feel that we should be getting dressed, we should be showered, we should be up, we should be ready, we should have a hair done if we need to go out, all of those things. So again, it's putting pressure on ourselves. It may be creating some of that guilt. Often people say, you know, I should be able to do these things, but if that level of fatigue's there, then no, you know, it's acknowledging that there is a limit on the amount of energy you've got and how much you can do. Also, you know, domestic activities of daily living, keeping up with the housework, you know, keeping up with standards that you've already set for yourself. And again, saying to yourself, well, I should be able to do this. You know, the house should be tidy, it should be clean. Again, we will address that. And again, you know, looking after your baby, looking after yourself, looking after young children, looking after other family members. There's lots of different circumstances that all of you will be going through that are very different and unique to all of you. So when we're looking at managing the fatigue and what is causing the fatigue, those strategies will be different for everybody, but also the cause of fatigue for you as individuals will be very, very different. So I think it's really important to recognise for you where the fatigue, you know, what is causing the fatigue, but also what are the specific symptoms, how is it manifesting in you that might be different to other mums, but also really important to look at the symptoms that you've got. Are they being caused by the fatigue? Are they new symptoms that have come about? Are they symptoms that need to be checked by your clinical nurse specialist? Do they need to be checked by the consultant that you're seeing? Or are they a part of the fatigue itself? And that's tricky because there's lots of overlaps there. But I think for some of you that have had symptoms and that have got symptoms, it can be reassuring to know that those symptoms can be a big part of the fatigue that you're experiencing. Okay.
That's great. Thank you so much, Leslie. So the next question. Some of our mums talk of having seen a wide variety of suggestions on social media about remedies and techniques to help cancer patients recover their energy levels. Could you talk us through what steps you would advise for any of our mums who are struggling to function with their fatigue, and where they might go if they need some additional help?
Okay. I think initially it's really important to think about the fatigue itself as a bank account. So it's rather than a bank account of money, you've got a bank account of energy. So when you wake first thing in the morning, just as with our bank account, there's so much money in there. With fatigue, there's so much energy. You've got a certain level of energy that morning, and that's how much you've got for the day. And it's going to be supplemented a little bit by the amount of energy, by the amount of food, that you put in there. That's going to gain some energy by the amount of fluids that go in there. But ultimately, you're not going to be able to do a lot through the day to gain more energy. So we've got to then think about the demands on that energy. So what are the tasks that you're going to do through the day? What activities are you going to be doing? What have you got going on that's particularly stressful at the moment? What's going to be particularly emotional, taking that emotional energy from you? And looking at those demands, we've got to start to think about how then do you pace those demands throughout the day? So if we look at the bank account, it's similar to, you know, you've got £100, you go in the first shop, you spend all £100, but you've still got another 9 hours of shopping to do. You haven't got any money left. Where does it come from? Now, quite a lot of this with our bank accounts, you've got an overdraft facility. So you can carry on spending. You can carry on buying more items in more shops. You can use the overdraft, so you still got your items. But actually, at some point, the overdraft's got to be paid off. You've got to pay it back. And in terms of energy, what that means is if you've done more tasks and put more demands on the body than you've got energy for, you can carry on. And what will happen is that stress response that we spoke about before, that will start to come in. Your body will start to produce adrenaline. Anybody that's got young children will see them as tired and wired, that overtired feeling. They're coming to the end of that energy. They're getting very sleepy, very tired, ready for bed. Suddenly they're wide awake and they're running around, and there's a second wind, you know, for want of a better word, that comes along. That can be the same that happens with fatigue, particularly if we push through, particularly if you're spending more energy than you've actually got. And you then get a false energy. You get adrenaline coming into the system, feel like you've got some new energy from somewhere. Oh, great, I can carry on. I can finish the ironing. I can go and do different tasks that I need to do. With that overdraft and with that adrenaline, there's got to be a payback. It's not true energy that you've got, even though it feels very much like it at the time. You know, when you buy an item in a shop with an overdraft, or whether you buy it with your own money, it feels exactly the same. That item is the same item. And it's the same with energy levels. You know, that false energy that you get from adrenaline feels very, very similar to the true energy that you've got. And it's not always easy to recognize when you're going into that overdraft. So that, again, is something people can look out for. And also, you know, you've got to have that payback. So there will be days, if you're in that boom bust, if you're pushing through, that then you've got days where you need to rest up. And when we're looking at managing the fatigue, what we're looking at is trying to avoid that boom bust pattern. We're trying to start to pace activities. So one thing is to recognize the different activities. So there's physical activities. Anything where your body moves is a physical activity. Even if it's moving from sitting to standing, if it's getting out of bed, anything, it doesn't have to be exercise, anything where the body moves. Anything where you're using your brain is a cognitive activity, a mental activity. All of those use energy. Anything emotional, anything with feelings, anything that's emotive, again, uses a level of energy. And that homeostatic energy, homeostasis is our body dealing with the internal and external demands on it. So your heart beating, you know, itself, your lungs moving, all the processes that are going on in your body that happen naturally every single day that we don't even think about. When we're not fatigued, it doesn't matter. They do their job. When we are fatigued, if we're digesting a big meal, you're going to feel more tired. You know, if you're, you know, obviously if you're not pregnant, if you're having your period, those things are going to take a lot of energy. Any processes that the body is carrying out will take energy. So there may be different times in the day that you recognize you're more fatigued than others. So what you can start to do is start to pace activities. And what can be really helpful is to keep a bit of a diary. So 3 or 4 days of a diary where you just write down each hour of each day what you've done. And you may see from that diary that actually I didn't stop for 2 days. I just carried on with activity. I didn't stop. I didn't have a rest. I had a day where I just carried out physical activity all day, or a day where I was studying all day, or I was at work and just using my brain all day, and I didn't stop and I didn't give it any time to recover. Now, if you think about it back to the bank account, a better way, rather than spending the whole £100 in the first shop, is to think, well, I need to buy 10 items. I'll go in 10 different shops. I'll have a break in between. I won't just keep spending, you know, £10, another £10 and another. I'll stop and I'll spend £10, but then I'll just go and sit down. I'll people watch for a little bit in the middle of the town, and then I'll go to the next shop and spend a bit more. So that you're spreading the spending out over the day. So you've still got some left in the afternoon to go and buy that item that you needed. And it's the same with activity. If you can think about the activities that need to be done in that day, and you can spread them out throughout the day and have times where you stop in between, what that means is that overtiredness doesn't tend to happen the same, because when you stop, not only are you not then spending energy, but you're also getting a little bit of energy back in. It's like the money in the bank account. If you're not spending it and it's there, it stays the same, but it also gains a little bit of interest on it as well. So it's good to do that periodically throughout the day. And it also means that when you're starting to become tired, say you do something for an hour, and then you start to feel, oh, I really need to sit down now. Rather than pushing through, if you push through, that means that the level of adrenaline in your system starts to come in. It starts to creep in. It helps out. And if you keep pushing and keep pushing, the level of adrenaline gets higher and higher and higher. So at the end of the day, you've actually got quite a high level of adrenaline in your system, and that takes a long time then to subside. Now, if you do a certain amount and you get a little bit of adrenaline coming in your system, but then you stop and you rest, the adrenaline soon subsides. There's not much in your system. It soon goes, and then you're almost reset for the next activity that you do. So it's really helpful to do that through the day, to do a certain amount, stop, rest, let everything reset, get a bit of energy back in there, and then start again. Obviously, that is the ideal. I can almost sense people sitting there, but I've got a newborn baby, I've got a child that's running around, I'm at work, how do I just stop? Yes, very, very, very difficult. But it's thinking about, how do you get snippets of time where you can stop? Being a bit creative with it. If you've got a young child that's sitting and will look through a book, is that a better way for you to try to have a bit of a rest than running around picking a football? Are the ways that you can slow down what you're doing? Are the ways you can stop what you're doing? Are the ways you can do things differently? Can you sit down to do an activity rather than standing, because it doesn't take as much energy? Can you think about ironing a few items each day throughout the week rather than standing and doing a whole basket of ironing all in one go? Can you break activities up? Also, think about the standards that you set for yourself. Are you still trying to do things like you've always done them to a high perfectionist standard? Can certain activities be done to an adequate standard that's absolutely fine? Can you just fold clothes that come out of the dryer and put them away rather than ironing them? Are there certain things that can be done less often in a week? Can you prioritize things? It may be that you say, oh, well, I always just, had a quick clean around the bathroom every morning by the time everybody'd left the house. Does that need to be done? Is it necessary? So it's checking in with yourself, because it might not be that you can pace yourself always by just stopping and having the rests, but can you limit the amount of demand that is being put on you at the moment? Are the people that you can delegate tasks to? Quite often we all like to do things the way we like to do them, to the standard that we like to do them to. Is that necessary? Can we pass things over to somebody else, even temporarily? I can do this once a week, but I'm struggling to do it 3 times a week. So could you do it the other couple of times and I'll just do it once? There's different things that other people can do that you don't have to do. There'll be certain jobs within the home that only you can do, but there'll be other things that other people can. So it's just thinking about, can I delegate? Can I ask others for help? None of us like asking others for help. That can make us feel, maybe, you might have feelings of feeling that you're lazy, or feelings that, oh, I should be doing this, it's my baby, I should be the one doing that. But ultimately, if you don't look after yourself and if you don't get yourself well, then in the longer term, that's going to create more problems. So it may be asking for help in the short term, whilst you're able to get a bit more energy in there, that helps things in the longer term. So it is checking in with yourself, seeing maybe are the barriers that you're putting up quite innocently, you know, just by doing things to a perfect standard and not even thinking, could I do that differently? It's starting to just have those thoughts about how you're doing things and why you're doing things as well. Am I doing something just because it's a habit? Because I've always done it, and I've always done it that number of times in a week. Does it need to be done? So I think, you know, just checking in with those questions with yourself can be really helpful. Looking at sleep, you know, can you try to regulate sleep? Again, depending on circumstances, could be very, very difficult. Can you just grab sleep where you can? Can you sleep when baby or young children are sleeping? You know, are the things like, if you are pregnant, is posture a difficult one for sleep? Can you have different pillows? Can you have cushions? Can you have props that are used, wedges that are used in bed to make that sleep easier and more helpful? Again, you know, looking at the cancer diagnosis, looking at the treatments that you've had, are there particular areas of the body that you're not able to sleep on? Can you speak to an occupational therapist or a physio to make things more comfortable for you? Because even though sleep isn't particularly restorative when we're fatigued, it is still helpful to be able to have sleep, because you've then not got that frustration about not being able to sleep. So it's looking at the practical side of things. You know, is the environment helpful for sleep? Is it dark enough? You know, is it coming light in the morning? Are there things like the alarm clocks that come light in the morning that can be helpful in waking you in the morning and get that circadian rhythm back on track again? So with regard to sleep, it's looking at practical elements of it. It's looking at, are you going to sleep when you've still got a lot of adrenaline left in your system, which again, that's not helpful for sleep. If you think about the fight or flight response, and that's when we have the adrenaline, physiologically, our bodies aren't set up for sleep if something's going to come in and kill us. So, you know, we're wide awake, we're ready, we're alert. So is that the reason why sleep isn't happening? So is it actually, rather than thinking, oh, I'm not going to bed yet, I'm not tired, have you missed that window of sleep? Have you pushed and gone beyond that? So actually, should you have gone to bed earlier than you think, when you were just starting to drop asleep? You know, are you thinking 10 o'clock's too early for me? You know, I've never gone to bed at that time. But actually, if you're tired, again, our bodies are very clever. They tell us when we need to sleep. We can't bring sleep on ourselves. That will happen. Thinking about, you know, having lots of caffeine. If you have too much caffeine, then your body isn't able to absorb the hormones that come about to enable us to sleep. So it might be that you're fatigued, drinking lots of caffeine to keep alert, to keep going, but actually that could be having the adverse effect. The same with energy drinks. That's another thing that isn't, you know, I wouldn't advocate that, because that again can have the adverse effect. It gives a quick burst of energy, just like drinking something that's really sweet or having a Mars bar or something like that, but you then get the slump after it. So that brings me on to diet, looking at where you're getting energy from. And with diet, it's quite easy sometimes to eat little and often. People often don't have a good appetite. They're feeling a bit sickly. Sometimes they might be feeling sickly more in the morning. You know, obviously pregnancy, there's sickness, you know, that's linked with that. So it's thinking about, can I have the same amount of food in a day, but can I eat small amounts more frequently? So that you're getting that good stream of food going in there, you're getting a constant release of energy in the body, rather than, and also your body isn't having to digest a big amount of food, which again could create more fatigue. So it's just thinking about doing things slightly differently. In terms of particular types of food, a good variety of food obviously gives you that good variety of minerals, nutrients, vitamins that you need. Also, plenty of fluid intake, water in particular, if that's something that you can manage to tolerate throughout the day. But also looking at low glycemic index foods, so foods that have that slow release of energy. So, you know, your porridge oats. If you're thinking about bread, think about brown bread instead of white. Same with rice, pasta. anything that you can, you can Google low glycemic index foods, low GI foods. There's lots of them, lots of different ones out there. Equally, you can look at what's high glycemic index, and those are the things you want to be avoiding more. So they're generally lots of carbs, lots of sugary foods that give us a quick fix, which is fine. And that can be a go-to for people, obviously, that are feeling fatigued because they feel, oh, I need a good strong coffee and, biscuits and things that get in that food in and that energy in quickly, which is okay at the time, but then you're going to get the adverse effects of the slump afterwards. So again, it's just making small changes, are the things that I can start to do to make a change to how much energy my body gets in the first place. Is that going to be helpful? Also, that can mean that making meals could become slightly easier because you're not standing making a big meal. It might be that you're having more snack type foods that are easier to prepare, quicker to prepare. Thinking about foods as well. If you are making something, if you're able to make a meal for, say, 2 people, can you add a little bit extra and make enough for 4, which usually doesn't take twice as long, but it means you can put some extra portions in the freezer. You can have that batch cook for other times where maybe you've got a lot of demands on you in a certain day. So to come in from work and actually have a meal that's ready made in the freezer, but it's a good meal, it's not that processed food, can actually be really helpful. So again, it's just thinking about ways that you can conserve energy over time. So it may be doing a little bit more in initially, but that means that over the week and over the month, actually, you can then start to pace things out. You're not doing something, that's going to take a lot of energy from you every single day. Also, looking at what to do in rest times is really important, because people may say, oh, well, yeah, I could stop then. Okay, I'll try that. But actually, all I'm doing is sitting down thinking about what I should be doing and looking at the basket of ironing and looking out at the garden and looking at the clothes that I haven't put away. So actually, I'm getting more stressed by sitting doing nothing than I would be if I'd just carried on doing that activity. So should I not? Is it not better just to carry on? So we've got to think about rest times, and sometimes it's easy to think, rather than thinking about resting, it's just easy to think about stopping spending more energy. So again, if we go back to the bank account, you're not going to get any more energy in, but if you stop spending money, it means you hold on to what you've got for a bit longer and you get that bit of interest on it. So even just to, if you were sat out in the garden, even just to stop doing that bit of gardening, but just to stop and admire the garden for a while, just look at the birds that are flying around, listen to what you can hear, look at the flowers, the different colours, that mindfulness type of activity. It means that you've stopped the gardening, so you've stopped using energy on that activity that you were doing, but you're also then not sitting, thinking and worrying. You're not stressing about what you need to do next. You're just appreciating what's there in that particular moment. And that's not easy to do. It's not easy to do when you've got a big list that's still sitting there that needs things ticking off. It's not easy to do when you've got a baby, small child. It's not easy to do when you're pregnant and you're not feeling well, and when you've got cancer treatments going on. So there's lots of barriers there, but it is something that does improve with practice. And I do have a lot of people that will dismiss sort of mindfulness and relaxation type strategies quite quickly, because one thing they feel, it's another thing on my list that I need to do right now. I've got to relax as well. So that's something else I need to do. So that it puts an extra demand on them, an extra worry if they're not doing it. Oh, I should have been relaxing today and I've not done that. So that can create another stress. So if you can just see that doing the best that you can, giving it a go, giving it a try. Relaxation techniques as such aren't for everybody, and certain techniques work better for some people than others. Some people are quite visual. Some people find it easy to sit in a garden and just look at everything around them, look at, the petals of a flower in great detail, what are the different greens that they can see throughout the garden. Other people prefer things like textures. So they'd more happily sit on the grass, you know, put a chair on the grass, have their feet on the grass and be able to feel what's going on underneath them, you know, what's the wind that they can feel, how warm's the sun, those sorts of things. You know, have they got the dog there sat on the knee of the cat and they can feel that? And that is something that can be quite comforting for people and can engage their focus. For other people, it can be what they can hear, quite auditory. So again, sitting outside, you know, what can you hear that's going on? Can you hear lawnmower three doors down? Can you hear the birds? Can you hear children laughing? You know, lots of things that you can hear that really we normally bypass. You've probably been out there doing the garden for the last half hour and haven't heard any of these things because you've been focusing and concentrating on what you've been doing. But actually, when you stop and you listen properly and focus, that's when you hear these things. And the whole point of having a focus on something is that that focus then isn't on your own thoughts, your own maybe negative thinking, your own worrying, your own stresses, your own, you know, what should I be doing now? What have I got to do later? What haven't I done yet? All of those things that are going to feed into the fatigue. It's just having something neutral, really, to look at, to think about. You know, smell is another one. That's another, obviously, it's trying to engage those senses. You can try and engage one at a time. You can try and engage one after another, or all of them all at once. So, but it's something that you can do really in any situation that you're in, wherever you are. You know, you might be sat at traffic lights getting all stressed and thinking, oh, this isn't any good for my fatigue. Right, well, just sit and think about what's playing on the radio at that time, what's going on around you, what you can see, what does it feel like sitting on that seat. There's always something in any situation that you're in that you can focus on that takes your mind away from stresses and worries that are then taking away that energy from you. But it takes practice. So it might be that you just start and you set yourself a minute, 2 minutes, and you just stop what you're doing, have a little bit of a rest, have a cup of tea, have something where you stop and then think, you know what, I'll just try 2 minutes. I'll just see what I can hear, even just sitting in my lounge. What can I hear going on? Is it just a clock ticking? What can I focus on? There is a lot of research to show that the amygdala in the brain does change with mindfulness. They've done brain scans before and after, and they've seen changes there. And it helps you to be able to start to focus again. When we think about those cognitive difficulties that people have with fatigue, being able to concentrate, being able to keep focus on something for a certain length of time, that attention span, we know with mindfulness and with relaxation that as we calm down the nervous system, because ultimately that's what relaxation is doing, it's calming down that nervous system that's all heightened with the stress of everything that you've got going on. When that starts to calm, we come out of that stress response. So we've got two sides to the nervous system. We've got the nervous system that is heightened, that sympathetic nervous system. That's when we're in fight or flight. That's when we can't make decisions, when we can't focus, we can't concentrate on things. With relaxation, what that does, it focuses less on the sympathetic nervous system and more on the parasympathetic nervous system, which is that rest and digest. That's when your body's restoring. So the more things you can do through the day to have that parasympathetic being the stronger side of the nervous system, that rest and digest where everything's calming down. You know, if you think about it, when you're all nice and relaxed, that's when it's easy to make a decision. That's when it's easy to focus, when it's easy to think about things. You know, we're not feeling overwhelmed. We've not got any of those stresses going on. So it might be that if you have got important things to talk about that are quite emotive, that are going to create that stress, doing that after you've had some time to stop and relax is a better time to do that. Again, with eating your food, if you're doing that in a more relaxed state, then your body is going to absorb more from that food than it would if you're in that heightened stress response. Where when we're in the fight or flight, the last thing we're thinking about really is starting to eat a nice meal, isn't it? And sit down quietly and eat that. It's just get in whatever fuel we can get in as quickly as we can. And then we've got the energy to do what we need to do. And our body just digests that as quickly as it can to get a quick fix of energy. But that's what we don't want. We want our bodies to absorb those foods, those nutrients properly, slowly, for the digestive system to be working properly. It's put on the back burner when we're in that stress response because it's not really needed. So any time that you get to feel that you can just stop, have time when you can do a little bit of relaxation, maybe lots and lots of different resources on YouTube that you can look at, all different types of relaxation. Yoga Nidra is one that is particularly good. That's specifically for calming down that nervous system. So you might not necessarily feel the effects of it straight after you've done it, but cumulatively, if you keep doing it and practice that, say, on a daily basis for 10, 20 minutes, when you just get that time, you can do them before you go to bed at night, before sleep, when everyone else is sort of in bed and the house is quiet. It will have that cumulative effect of calming down that nervous system over time. So I think in terms of you starting to manage the fatigue, make an activity diary. Look at where your energy is going. And think about different activities take different amounts of energy. Just as different items in shops, you can spend different amounts of money on them. Same with activity. So think about how long you do something for. If it's a real high level activity and you feel exhausted very quickly from it, don't do it for very long. And there's going to be certain activities that you do that are what we call low level. Yeah, you feel a bit tired after, but you can do them for longer. You can do more of them, do more of those. And then there's going to be some that are in the middle there that are sort of a medium level activity. So if you're thinking about on a daily basis, try just to have 1 or 2 high level activities. If you've got something particularly stressful going on, you know, if you were going for results or things like that, that's going to take a lot of energy and a lot of demand, for the rest of the day, try and rest, try and do more low level activities. And when you get to the point of knowing how much, or having a better idea of how much energy your activities take, you can then almost try and prioritize and make a plan for the week. What activities do I need to do? What activities can I delegate to others? What needs to be done this week? What can I do in a month's time? And have that plan to then be able to pace those activities throughout the week. So you're going to prioritize what your activities are. You're going to have them on a plan. Where am I going to do them? You could have that on a physical written plan. So you're not holding that information in your head. So again, you're not taking energy to do that. And then you're going to pace them on your plan with rests in there. So it might be, you know, you walk the dog, you come back, you sit down, you have a cup of tea. Then it might be that you look at your finances and you deal with some emails, because that's a cognitive activity. So you've just done a physical in walking the dog. So then it's a good one to have a rest, but then maybe do something that's more brain work, so that your legs that you just used to walk the dog are then still resting. Your brain was resting while you were walking the dog. You weren't using that very much. So to try and have those activities alternating throughout the day and the week as well can be really helpful. But having those regular sort of stop times or break times. And if you can't stop completely, thinking about how can I do something differently? You know, we've just been running around outside. Can we go and sit down? Can I watch my small child making something with Lego? So I'm not as involved, but I'm there, but actually I'm sitting and I'm resting as much as possible. So think about stopping using energy as the alternate to using energy. So through the day, it's going to be use energy, stop using energy, use energy, stop using energy, and doing that through the day. The difficulty is knowing how long to do that for, and that's where it becomes more complicated. But I'm aware today I'm just trying to give that overview really of, you know, things you can start to do. Okay. When you're managing fatigue, it really is looking with everything at the balance. So it's a balance of activity and rest. It's a balance of resting, but not resting too much. Because equally, if you just rested all day, that wouldn't help with the fatigue either. So it is that balance of the two. It's a balance of sleeping enough, but not sleeping too much. It's, again, with food, you know, eating enough to get in those nutrients that you need, but not eating too much, because then that gives the body big demands on what it needs to do and how it needs to digest it. But eating enough to get the right amount of, you know, nutrients and level of energy in there. So it's thinking about also the types of activities that you do. You quite often, people miss the enjoyable activities because they've got a certain amount of energy. They use it for all what they think is a necessary activity. And that means that the fun and the enjoyable stuff has gone. And, you know, if you think about the situations that you're in at the moment with the cancer diagnosis, with the treatment, with everything that's going on, you need some fun. You need to have, even if it's a small amount of an enjoyable activity each day, that is needed. That is highly important when managing the journey that you're on at the moment, but also when managing the fatigue, because anything that we do that is fun and enjoyable gives us that release of stress, which puts some energy back in. We get a feeling of satisfaction. There's lots of good things that come from enjoyable activities. Being with people that we love, people that we enjoy spending time with, you know, talking about things that we enjoy. So that's a real difficult one because those things have often been lost. Again, more fatigue comes with the loss, the grief of that. So think about, it might not be activities that you have always done and that, you know, you were able to do previously that were enjoyable and fun, but it might be thinking of new things, different things that don't take a lot of energy but get a quick burst of that enjoyment and that feel-good factor. Even the relaxation strategies themselves, people find them quite enjoyable. It's a bit of time out, it's a bit of time away, you know, where the mind's focusing on something else rather than everything that's going on, because I'm guessing that for a lot of you, your minds are going to be very busy. You've got a lot to think about, a lot of plates to spin. So having that time out from that and putting in something that's enjoyable is really, really important. So it's having that good mix of activities throughout the day and looking at, what do I need to do differently to what I'm doing right now in order to start to manage the fatigue. And when you start to do all of these things, then the body becomes more stable. Things have a knock-on effect with each other. So if your eating habits are better, you then get a bit more energy. So you don't then necessarily have to be in the boom bust pattern. You get a bit more energy to do the things that you need to do. So you don't get that adrenaline fix coming in the same because you're not tired but wired. So when you go to bed, you actually sleep a bit better. So each of the negative cycles that we've spoken about, once you start to tap into all of them and address all the different things that we've discussed, those negative cycles start to become more positive cycles, and each positive cycle has a positive knock-on effect with the others, rather than each negative cycle having that negative knock-on effect. So people often find once they start to make small changes, then that will alter something else and mean, oh, I don't get quite as many headaches now. Oh, so I can read a bit more and I get a bit more enjoyment from that. So that's good. You know, I was reading for trying to block everything out and read for a couple of hours, but actually I've found I can read for half an hour, have a bit of a break, go for a little walk, come back and then read for another half hour, and I don't get the headache then. So it's making those very, very small changes, but maybe quite a few of them, to different aspects of, you know, how the fatigue's manifesting in you. And those small changes then start to have that knock-on effect to the overall picture.
Super, Leslie. There's a lot of helpful information in there. Thank you for that. I'm conscious of our time now. I'm wondering if I could slip in just a quick question at the end here, if that's okay with you. A question that mums often ask us is, how often does it take to start feeling like you've got energy again? Now, I appreciate that there won't be a one-time thing for everybody, But I'm wondering how you would address that if somebody came to you with that question.
Yeah, I think it really is looking at everything that I've already spoken about and thinking that starting to make those changes is going to enable you to start to stabilize. And the initial thing that I would always be looking at when I treat people is getting them to that sort of stable point where they're not getting more and more fatigue, but it's still there, but it's at a level where it's not necessarily going any worse. And the quicker that you can stabilize, then the quicker you can start to add in more activity, because that's when more energy starts to come in. So I think what I would say is, obviously for everybody's circumstances are different, aren't they? So the more changes that you're able to make, no matter how small they are, the quicker you can make those changes, but also maintain them, the quicker you're going to stabilize, and then the quicker you will start to feel that you're getting more energy and that you're able to do more. Now, I think it's also worth saying that when we look at fatigue and improvements from fatigue, people don't always have an immediate fix with the symptoms. So they may still be getting the symptoms that we spoke about, and they may still be feeling fatigue, but they can do more. So that's an indication that actually there is more energy there, even though they may not still be, it's not going to be that the fatigue just disappears and all the symptoms disappear. They will stabilize first of all, and then they will start to lessen over time. But if the person feels that they're doing more and they've noticed, oh, I can read for a bit longer, or I've got a bit better attention span there, or I can walk for further, that's a good indication that the fatigue is improving, even though they may not feel better. And that's a really, really important thing to hold on to, because quite often people are waiting for the symptoms and the fatigue to go before they start doing more. So what I would say is, once you feel you're stable, then try to do slightly more of things and have slightly less rest, so that you can then start to see that progression there. And once you see the progression, obviously that then helps with the mental health side of things. Oh, I'm feeling a bit better, so the more fatigue drops off. So I'm not able to give that definitive answer, obviously, of it's going to be this amount of time, but the most important thing is trying to stop the negative patterns, stabilize, and then think about being able to gradually increase the amount of activity that people are doing.
That's lovely. Thanks very much, Leslie. I think we could all say we appreciated your contribution today, and I think a lot of our mums will benefit from your discussion.
I hope so.
Today.
Yeah.
So thank you very much for that.
Okay, no problem.
Right, Leslie, I have another question from a mum, and she asks, what happens if you don't rest and just keep going? I continue to receive chemotherapy, and I have a 1-year-old and a 6-year-old. I'm starting back at work 2 days a week after maternity leave next month. I would like to rest, but is it dangerous to always push through it? What is physically happening?
Right, so I think, yeah, the problem that may be caused there is that boom bust, because it's obviously got a lot of activities, a lot of things going on. So it's looking at ways that you can start to put some of those stop times in, getting some of those rests, and even whilst at work, obviously speaking with the employer and saying, this is something that I'm dealing with, reasonable adjustments need to be made so that you have maybe a breakout room that you can go to that is quiet. It might be looking at the environment at work, thinking, is there a quieter office that I can work in? Can I do my job sitting down? Looking at any ways that you can lessen the demand of the activities that you've got to do. By continuing to push through, what that does, it keeps putting those extra demands on the body. So what can happen is the symptoms that you're experiencing, and not just the fatigue itself, but all the other symptoms that we spoke about, can worsen, because if you think about them as being kind of alarm bells to tell you to rest more because your body needs to rest, they're going to shout louder. So headaches may become worse. You may become more emotional, more tearful. It'll be different symptoms for everybody, but it may be for you in particular that there is one symptom that is a nagging symptom that's there and is just coming more to the forefront. So the symptoms will come more and the fatigue will come more as well, the more you continue to try just to keep pushing through. And it could end that you really get to a point where you're struggling more than you are now, and that a crash may happen where you just hit that brick wall. So it's really important to just think about how you start to implement some of these strategies now. But I think certainly speaking with your employer is helpful. There's a booklet by the Macmillan, Coping with Fatigue, that I'm sure many of you have seen. That is really helpful, but it is very explanatory and it's really quite simple to understand. So I think that might be something that's useful to give to the employer, just to be able to look at that, to say, this is what I'm dealing with. It isn't tiredness. And whether you've got, occupational health, HR already involved as well, they obviously, it's worth tapping into those resources as well, so that they can put things in place for you at work. Otherwise, it may be that it is that boom bust of you give everything to work, and then after that, you're crashing in the evening. So a boom bust pattern is happening all the time.